So I am so pleased to introduce today's presenters, Carolyn Gomez-Tom, Director of Patient and Community Engagement at 16th Street Community Health Center, and Megan Sprecher, Immigration and Poverty Law Attorney at End Domestic Abuse of Wisconsin. Both these women are absolute gems. They have been essential to the work of the Wisconsin Collaboration on Immigration and Public Benefits. And without them, that work would have been much diminished. Megan's intersectional legal expertise in immigration and poverty law is hard to find among attorneys in Wisconsin, and it has been foundational to our work. Carolyn has provided so much information and foundation on the complexities of immigrant eligibility for various health insurance programs, and she gives us continual insight from patients, consumers, and communities. I also just want to mention the efforts of Stephanie Sievers, who's Insurance Literacy and Communications Manager at Covering Wisconsin. She was essential in preparing today's presentation. Thank you, Stephanie. We know you're listening. So with no further ado, I will hand it off to Caroline Gomez-Tom to start us with information about health insurance eligibility for immigrant communities.
I should probably unmute myself. Thank you, Shannon. Thank you for the really warm introduction. I appreciate that. And I want to thank everyone who is on a webinar training at like 9 o'clock sharp in this crazy world that we live in right now. So let me just get this rolling. Wonderful. So as we start today, I do want to lead in with a disclaimer that we are going to discuss scenarios and common cases that people might find themselves in to be eligible for whether it's Medicaid or the marketplace based on their immigration status. But I do want to lead in with the fact that the best way to find out if someone is eligible for any of these programs is for them to apply. We're talking kind of in the hypothetical, we're really leaning in on the immigration status eligibility rules, but we're not talking about really the whole situation for an individual or family. And so it's very important that we are that we're taking this with a grain of salt, that we're learning the rules, but know that they're not always steadfast and that the best way is for them to apply for coverage. And like I mentioned, we're focusing on Medicaid and Marketplace, but there are other types of coverage that may be available to these individuals. And so it's good to know that there are tools and resources provided by Covering Wisconsin that can be used to help, specifically the employer eligibility tool, and then options for your family, which goes through kind of all the other variable options that are available to each individual. And today we're going to be going through a lot of information, so please know that this isn't something to absorb all at once, but we will be talking about types of immigrant status and households, Medicaid eligibility for the immigrant community, marketplace eligibility for the immigrant community. Megan Sprecher will be then going over the public charge rule, and then we'll be talking about some common case scenarios and resources. All right. So first, we're going to talk about types of immigrant status and household. Before we can even get into eligibility, we have to define what are eligible immigrant statuses. So each program that we talk about today, Medicaid and Marketplace, define eligibility for immigrant community members differently. For Medicaid, they look at U.S. citizens or qualifying immigrants. And we'll talk a little bit about what that looks like. And then Marketplace says U.S. citizens or national, or national, or to be lawfully present. And we'll discuss what that looks like. All right, so when we talk about Medicaid public benefit programs for qualifying immigrants, we're talking about BadgerCare Plus. So health insurance for low-income men, women, pregnant women, and children in Wisconsin, and then Medicaid for the elderly, blind, and disabled. And so that's health insurance for low-income people who are 65 and older. And I asterisk Medicaid programs because I'm not referring to emergency services or prenatal services when I am specifically saying Medicaid. We will talk about those two other programs as it pertains to the immigrant community, but I do want to lean in that we're really just talking about, when I say Medicaid, we're talking about BadgerCare and elderly, blind, disabled Medicaid. All right, and then the list of eligible immigrant statuses as defined under the state law of U.S. citizens or qualifying immigrants most commonly include U.S. citizens, so that's children, pregnant women, and adults, refugees and asylees, children, pregnant women, and adults, permanent residents, children, pregnant women, and adults who have been a permanent resident for more than 5 years. That's the only group that has that wait period. Children and pregnant women are not included in that 5-year wait period if they're permanent residents. And then some visa types, such as victims for domestic abuse or human trafficking. And there are some other nuance types. And so that's why I always say the best way to know if someone is eligible is for them to apply. All right, and I know we're talking about immigrant statuses, but I want to make sure that this is available to folks, is the BadgerCare Plus income levels. So knowing based on someone's household size, what they may be eligible for based on their income. This will be looked at regardless of immigrant status. It's looking at who lives in the home or who lives in the tax filing household if you're looking at Medicaid or Medicaid and Marketplace. All right. So children born in the U.S., they are eligible for BadgerCare Plus, even if their parents are not. And that's something important to take on, especially in this world of public charge, because that's something that we've seen already happen where children have been disenrolled in BadgerCare because parents are concerned that this may impact their immigration status or even worse, risk a family member being deported. But that is not the case in terms of the law and the rules of eligibility. So children who are U.S. born are eligible for BadgerCare Plus income and all other eligibility allowing, regardless of if their parents are not eligible. And then children who are qualifying immigrants, so not necessarily U.S. citizens, but are eligible because they're permanent residents or refugees or asylees, aged 18 and younger, do not have that waiting period, that 5-year wait period. And it's important to know, and we'll talk a little more when Megan's talking about public charge, but children enrolled in public benefits or BadgerCare Plus, that eligibility or them enrolled in those programs do not negatively impact their parents or other family members who are trying to change their immigration status. And so that's very important. If that's one of the big takeaways you get is if children are eligible for BadgerCare, it's not going to impact their parents and they should apply. So immigrants in that 5-year wait period, I hear a lot of times that if they don't qualify for Medicaid, then they can't get any type of coverage. And that's just not the case. Many of the immigrants in that 5-year wait period will qualify for Marketplace coverage, and they will qualify for Marketplace coverage with a tax credit. And that's even if they're below 100% of the federal poverty level. I'll talk a little more about that in a future slide, but I just want to make sure that that is known, that if someone has an eligible immigrant status, they most likely have an option to health insurance. This is another useful slide. This is put actually together by Kids Forward, but it shows all of the different eligibility regarding income for pregnant women, children, parent caretakers, childless adults, family planning, which we'll mention later on, and then Medicaid for the elderly, blind, and disabled. This is one of the slides similar to that income eligibility slide that you should have at your fingertips. I can't enforce enough how important having some of these resources is. I guess what I would always tell my colleagues when I too was a navigator is that you might not know everything, and that's okay, but you should know where to find it. And so having resources like this is really good to just have available. And I see a lot of questions are coming in. And so I can only see them when they pop up, but then they kind of fade away. So I'll make sure that they're answered before the end of this presentation.
And Carolyn, I'm collecting questions and we'll go through them.
Perfect. Thank you so much, Shannon.
Yeah.
All right. Okay, so now I want to talk a little bit about BadgerCare Plus prenatal and emergency services. So for immigrant populations who do not qualify for traditional Medicaid programs, so like I mentioned, BadgerCare Plus and the the elderly, blind, and disabled Medicaid, due to their immigration status, they may qualify for these two programs. So for women who otherwise would be income eligible for Medicaid who are pregnant may qualify for BadgerCare Plus prenatal, even if their immigrant status bars them from the Medicaid program. And this is a very useful program because this covers all of the pregnancy-related costs. And then there's emergency services. And so this is for immigrants who also do not qualify for Medicaid, but otherwise would if they had an eligible immigrant status. And so we see a lot of utilization of this program for people in that 5-year wait period or undocumented immigrants. I do want to call out specifically that it also looks at those who are eligible for Medicaid, so children, adults above 65 or older, adults with disabilities, adults caring for children at home, so parents, and then pregnant women, all are eligible for emergency services. But I want to call out that there is a group that otherwise wouldn't be eligible for emergency services. When Wisconsin expanded, provided eligibility for BadgerCare Plus to adults up to 100% of the federal poverty level. Because we did it in our own way as a state, that did not expand emergency services for adults without dependent children under 100% of the federal poverty level. So unfortunately, adults without dependent children do not qualify for emergency services. But children, elderly adults, adults with disabilities, parents, and pregnant women all do. So just something to keep in mind. And there's actually a fantastic resource that Covering Wisconsin has created, particularly on emergency services. And it looks like this. A part of it looks like this. But this is a nice resource, especially because emergency services eligibility looks at when someone is having an actual health emergency where there's risk of losing life or limb. And so it's very important that they are talking to a medical provider, that the medical provider is essentially providing the information that's needed for eligibility to this program, because the provider is able to determine the length of time of said emergency and can help provide ongoing care if the emergency spans more than an acute point of time, so one instance. So you can imagine that there are many circumstances where someone may be in dire straits because of the health situation that they're in. And so emergency services can assist in those situations where it's not just a one-time instance, but it's ongoing, and that is through the work with the provider to determine what that time is. And then eligibility with income also looks a little different for emergency services. It doesn't follow the straight Medicaid income rules. So this resource is just a nice one to have at your fingertips as well, especially if you work predominantly with an immigrant community. I also want to call out family planning only services. So this is another program under Medicaid that covers sexual health services and supplies. So you're looking at birth control, sexual health checkups, condoms, which is also birth control, and then certain tests and treatment for STDs and other sexually transmitted infections. And so Covering Wisconsin also has a fantastic a resource where it discusses these eligibility rules. So for example, based on income, they look at income, and then for immigrant status, any U.S. citizen, refugee, asylee, legal immigrant, age 18 or younger, and then of course, a legal immigrant over the age of 18, but they've lived in the U.S. for 5 years or more, so that wait period for permanent residence, are eligible for the family planning only program. And they have to be of reproductive age, which is a very loose way of saying if they can make babies, they can be on this program. And they can have this on top of their current health insurance. So this isn't limited to someone without health insurance because it's only an additive program. It's not an additive program. It's not health insurance on its own. And then children can enroll in this program and do not have to report parents' income. So they can plan on their own and use an alternative address if they need be. And that helps a lot of young people get access to services that they otherwise wouldn't have access to. And then as a reminder, when you're applying on access.wi.gov, you can also help families enroll in Food Share, which is our food stamp or access to food program, and then Wisconsin Shares, which is child care services. And qualifying immigrants can apply even if they're not U.S. citizens. And there's some immigrant statuses like refugees, asylees, legal permanent residents under the age of 18 that can apply without the 5-year wait period for Food Share, and then permanent residents who haven't been here for 5 years that are adults would have to wait for the 5-year period. And then Wisconsin Shares is really interesting. This is actually newer to me. Immigrant parents of any status can apply for their children who are U.S. citizens or qualifying immigrants. And that's for the child care services.
So Carolyn, I'd like to pause and review some of the questions that we've gotten in and get some answers to folks. So we had some general questions about conference materials and about the presentation yesterday. So we're not going to answer those in this presentation, but I will work to get individual responses to those questions. So just wait for those. I'll answer those in the chat. Our first question is, are there any exceptions to apply for Marketplace or Medicaid for undocumented immigrants who are diagnosed with end-stage renal disease and are not eligible for emergency Medicaid because they do not meet the financial guidelines?
That's a great, complex question, and I appreciate it. And I don't think I will have the full answer for you, which is not the answer you want to hear. But I will say that it's best to work with your Medicaid office and department to see what they may or may not be eligible for and apply for that individual. But just listening to what you're saying, someone who's undocumented, who financially would not qualify for emergency services, what I would most commonly see for that individual is that they would be accessing the service, whether it's through a hospital or a federally qualified health center, getting them access to specialty care where they're able to work with the community health center on pricing, cost. They may have to work with the health system, utilizing charity care services, depending on the ongoing procedures that they need to have access to. And that would be one example of if really at the end of the day there isn't something that they're specifically eligible for due to income constraints, utilizing the network of our safety net clinics and access as they are connected to the bigger health systems for specialty care. Really leaning in on the resources that we have available beyond health insurance.
Thanks, Caroline. And it looks like we have crowdsourced another response and insight, which is that those individuals may apply for Medicaid and do a Medicaid disability application and allow the Disability Determination Bureau to make a decision to be treated under the elderly, blind, and disabled criteria. And then I was also going to point folks to the Wisconsin Chronic Disease Program and looking at their criteria for application and consideration. I don't know great details about that program, but you can, if you just search Wisconsin Chronic Disease Program, you can see that there is a chronic renal disease specific program. So I encourage you to check that out. Okay, so that we started it off with a complex one.
The easier?
Next,
No, I'm just kidding.
Yeah, the next one is easier, I think. The next question is, if parents and children are undocumented, the children can qualify for BadgerCare without being in the U.S. for a certain period of time?
Yes, there is no wait period for children who are otherwise eligible for a BadgerCare. So if they're U.S. born, of course, they are just eligible if everything else is considered. And then if they're permanent residents, if they are refugee asylees, if they're anything under the sun of eligible immigrant status under Medicaid rules, they would not have to wait the 5-year period. So they would be eligible even if their parents aren't.
Okay, great, thanks. Our next question is, if someone goes into the emergency room but gets upgraded to inpatient or outpatient care, does emergency services for immigrants cover them?
It can. And that's what I was really discussing when I was talking about that provider determination in terms of determining what is the length of emergency. Because if they are transitioning to a different type of care, that emergency could still be, and I say emergency as in risk of losing life or limb, because that's one of the ways that they define it in the BadgerCare Plus handbook. But it really is that provider that they're working with that helps determine what the underlying emergency length could be, and that can help cover those costs long term.
Excellent. Our next question is, are undocumented childless adults eligible for emergency services?
So unfortunately, they are not. And that is because of, as I mentioned, with the change in childless adults being eligible for Medicaid under 100% of the FPL, that was not applied to emergency services. There might be other ways that those individuals could be covered, as someone mentioned, if they were eligible under disability rule eligibility, that could be a possibility. But for a childless adult who otherwise would not qualify under a disability rule, they would not be eligible for emergency services.
Okay, And we have one more that just came in. So this will be our last question for this section, and then we'll move on to the section on Marketplace. There were a few Marketplace questions that we've gotten, and I'm going to wait until Caroline has the opportunity to review that information before we answer those questions.
You guys are eager.
So the last Medicaid question is, since children can be eligible for Medicaid and not needing the 5-year rule, can they be express enrolled? And she notes, I realize there are FPL categories for express enrollment.
So the short answer is yes, they can. And you're right, there are different income eligibilities for express enrollment, but as long as they are eligible or perceived to be eligible for the Medicaid program, they can be express enrolled.
Great, thanks. Let's move ahead.
Fantastic. Oh. All right, so now we're getting into the health insurance marketplace eligibility for the immigrant community. Fantastic questions, by the way. One, I love questions during a presentation because that means you guys are paying attention. Thank you. And two, really thoughtful questions to add to the discussion. So thank you. All right, so when we're talking about the health insurance marketplace, we're talking about healthcare.gov, and we're talking about the different options that are available. And one thing that I'm glad to be able to say is that the marketplace financial assistance or tax credits are not a public benefit, so they are not considered when looking at public charge rules. And I'll let Megan dive in deeper, but that's something that we can confidently say. And when we're looking at marketplace eligibility, they define it as a citizen or national or to be lawfully present. And that means nothing, right? What it really means is that marketplace coverage accepts almost all statuses. And so it's easier to define marketplace eligibility for immigrants by discussing who isn't eligible. And so the two outstanding immigrant groups that are not eligible for marketplace are immigrants who are considered undocumented, and then people who qualify under the deferred action for childhood arrivals, so DACA or Dreamers. My rule of thumb when talking about marketplace eligibility is if you can verify it, the person will most likely have some eligible immigrant status for marketplace eligibility. And these links in the presentation, when you get the full version, are live links. And the status link will take you to the list of statuses that are eligible under marketplace rules. And then the verified link will actually take you to what documents you need to prove said immigrant status under marketplace rules. Once again, things to have at your fingertips. And then I know that you guys have probably already talked about marketplace eligibility, but marketplace tax credit eligibility regarding income are for people between 100% to 400% of the federal poverty level, and that's based on household size, and that goes up incrementally. And that is true for all people eligible for marketplace, with the exception of what I mentioned, immigrant folks that are in the 5-year wait period, and we'll talk about that. So immigrants, low-income folks that are in the 5-year wait period because of their permanent residence status, they can apply for marketplace coverage because they otherwise would not be eligible for Medicaid. And this is the tip and trick that you have to be able to have in your back pocket, because I've seen many people go without health insurance because they apply for Medicaid and they are denied because they're in that 5-year wait period, and no one tells them that they can sign up for marketplace coverage. And this is a lost opportunity for that individual, for them getting coverage, for them staying healthy for their families. And so I may be the largest advocate for being very aware of this rule. So in our state, people are able to enroll in marketplace coverage by answering this one question. And it may look different, I will say, because this screenshot is from a 2018 application, but were any of these people denied coverage through BadgerCare Plus or BadgerCare Plus since December 13, 2018, or were any of them denied coverage through these programs due to their immigration status in the last 4 years? So if you know that that individual, based on their permanent residency card, is still within their 5-year wait period, you can check this box for that individual. And I just named them Muhammad student. And you would say, was this person found not eligible because their state, by their state because of their immigration status? By selecting yes, you override the marketplace assessing them for Medicaid because you already know that they're going to be denied. And it will allow you to then go into marketplace and they will be assessed for a tax credit, even if they're below 100% of the federal poverty level, because we've already stated that they don't qualify for Medicaid. And so rather than going through the whole process of getting a denial from Medicaid, having them to wait however long, you could be getting them coverage right away by answering this one question correctly. And so I really encourage you to get familiar with this one particular slide, because that could be the difference between getting them coverage almost instantly for that next month, or waiting an additional month or so to get a denial from Medicaid and then go back and go, what happened, and then getting the marketplace coverage. And then it can't be said enough that household and immigration status are so intersected because, we see in a household without any immigrant members that, we have to look and each individual might be eligible for a different program. But when we're talking about an immigrant family, there's a chance that family members may be eligible for different health insurance programs, but then there also may be family members that are not eligible for any health insurance. What we call this is a mixed immigration status family, and it needs to be known because we need to still figure out how to get them access to health care. And so due to varying immigration statuses, we may need to refer individuals to a community health center or a free clinic or another safety net resource in your community. And it's important to know those options as well, because we may encounter that childless adult who wouldn't otherwise qualify for marketplace, Medicaid, or emergency services. What can we tell them? Who can we connect them with? And that is just as important as knowing all these eligibility rules. And then I also want to talk about special enrollment periods, particularly to immigrant status changes. So you all are learning the different types of special enrollment periods. Like, for example, due to COVID, people can enroll in Marketplace if they've recently lost their job, 60 days from the day that they lose their coverage, before or after. But when we're talking about immigrant status, new immigrant status. So like, for example, if someone recently gets a permanent resident card, or if someone recently comes into the country on a student visa, or someone just gets their work permit, those are all opportunities to get them enrolled in coverage. And so you have a 60-day special enrollment period from the time that the person either receives that new status, so whatever the card date says on their new status, or if they haven't received the card in hand, and that 60-day window from the date on the card expires, you can also use the date on the letter when they finally do receive their card. Because a lot of times they'll get the status, but then they have to wait for the mail for them to actually receive the card in hand. And so I've successfully seen eligibility for special enrollment periods from the letter that they receive with their card. And that can be the verification to allow for the special enrollment period. And this is once again, a great resource provided by Covering Wisconsin that can help remind you about these different special enrollment periods. All right, Shannon, are we going right into this now?
Yes, we're going to do the
Or can you
polling
answer-
questions, Mike, so if you can put those up.
Do you want me to answer any of the marketplace questions before we go into these, or?
Let's do the first polling question related to the student example, and then we'll answer some of the questions that I've been accumulating here.
Beautiful.
If you want to put up the
And
next.
Shannon, I apologize. I will have to get that up in just a minute. We had a couple of questions come through on my email, and so I have been scrambling to answer those as relates to a couple of our panelists for the upcoming session. I apologize.
Sure.
I will get that up in just a minute.
Take your time, Mike, and in the meantime, we'll answer some of the questions. We've got plenty to do while we wait.
Perfect. Thank you so much.
No problem.
Thanks,
So
Mike.
our first question is, do you know of any insurance that will work with DACA recipients?
Off the top of my hand, off the top of my head, off the back of my hand, I'm really bad at sayings. Sorry, guys. Off the top of my head, I do not. There may be some programs, especially if DACA recipients are students. It may be worth looking into any of the student health insurance coverage that might be available to them. Those are some options to look into, but off the top of my head, I don't have one in particular in mind.
Thanks. So I think this is a good clarification follow-up. And the question is, just for clarification, are you saying immigrants who are undocumented do not qualify for Medicaid or Marketplace?
Yes. So someone who is undocumented, depending on if they're a parent, someone who is elderly, blind, and disabled, a child, a pregnant woman, they could be eligible for emergency services, but not Medicaid if they're undocumented, but emergency services or prenatal if it's a pregnant woman, they all could potentially be eligible for those two specific Medicaid programs. But otherwise, they would not be eligible for BadgerCare Plus or the health insurance marketplace. And then childless adults who are undocumented would not apply or be eligible for either of the programs.
Okay, thanks. So we have another question, which is, so if the immigrant does not have income and lives with a non-related person, does that make them eligible for the marketplace? And I think in reading this, we might need the questioner to clarify. I don't know, Caroline, that we can answer that.
So I'm going to tie that to the marketplace eligibility for people who are in the 5-year wait period. So if they're in the 5-year wait period and they have no income and they're living with someone, but they're not related to that person, then they would be looking at tax rules. And they would be able to apply on their own for the marketplace in that circumstance. And as long as that question that I mentioned is checked, they would not be sent to Medicaid for eligibility. They would look at marketplace plans, potentially, most likely, with a tax credit.
Thanks, Caroline. So we have the first polling question up, and if everybody can just take a moment to respond. So the question is, Mohammed, who is 19, is a student at the University of Wisconsin-Milwaukee. He has a student visa. What health insurance program might he qualify for? So here we're just talking about the connection to the immigration status and eligibility, recognizing that there are financial eligibility criteria at play that at this point are unknown. So we'll give everyone just a few more seconds, and then we'll let Caroline respond.
Wonderful. This is
Go
fun.
ahead. I can't see how many people have responded, but I'm going to say that's been enough time. Go ahead, Caroline.
All right, wonderful. All right. I know that all of you got this right. But the answer is that Mohammed would not qualify for Medicaid programs because he's on a student visa, and that's not one of those eligible statuses. However, he would qualify for health insurance through the marketplace because of that rule that I was just talking about, where as long as he checks this box, they won't look at Medicaid, but they will assess him for a tax credit in the marketplace because he has an eligible immigrant status.
Great, thanks. Let's go on to the next example scenario.
All right. Did you want me to read this one?
Why don't you read that? And Mike, if you can work on putting up the polling question, that would be great.
Sure. So this is a mixed status family example. So Natalie, who's 32, is a permanent resident of the U.S. and has 2 children, Roberto and Oscar, who are 4 and 1. Roberto is also a permanent resident of the U.S., and Oscar is a U.S. citizen because he was born in Wisconsin. Natalie and Roberto have been permanent residents for 3 years. Which health insurance program might each family member qualify for? And I don't know if the poll, is it per each family individual?
Yeah, so the polling question, when it gets posted, will have response. There'll be 3 questions: Natalie, Roberto, and Oscar. So while Mike works on that, we can go back to the Q&A. And we had in follow-up, so we just did the question on the student visa, the Mohammed who had a student visa and him being eligible for marketplace coverage. There was a follow-up question to that, which is, how about someone with a tourist visa?
So a tourist visa, so if you look at that long list, I do not think a tourist visa is included in the eligible status lane. And I know that I, said that anything that can be verified, but tourism, unfortunately, is not one where that's considered an eligible status for marketplace. You might want to verify that list though, because yeah, it's a long list.
It is a long list, and I did put it in the chat, so anyone can feel free to click into that and review it. We had another question about marketplace coverage for people with work permits. And again, I think we reflect on that list and kind of get into the details of what that permit is. But Caroline, anything additional there?
Yeah, so people with work permits can apply for marketplace coverage. There is a caveat. So people who receive DACA or are on the DACA program, I should say, do get a social security number and a work permit. And even with those 2 things, because it's through the DACA program, they are not eligible. This was something that was not included as a benefit or resource when the executive order was passed around DACA. So they are not eligible even with a work permit and social security number. But work permits on their own would allow someone to enroll in marketplace.
Okay. We'll do one more question. Hopefully we can get the polling question up, and if we can't, then we'll just go on to the answer. But we have another question connected to the student visa, and the question is, it was my understanding that for students here with a student visa, they would need to file taxes to qualify for the tax credit part of the marketplace subsidies. Oh, Caroline's back.
I think I froze, but what was the question?
The question was about marketplace tax credits. So it was my understanding that for students here with a student visa, they would need to file taxes in order to qualify for the marketplace tax credit.
So yes, you are correct. They would need to file taxes. And so that does mean that the student with a student visa would potentially have to file taxes with an ITIN number or some way where they would be able to reconcile their tax credits. And that's just a requirement of getting marketplace coverage.
Great, thanks. So we're going to give everybody a few seconds to answer the poll questions that are posted. Just do your best and we'll review the answers. Have no fear. We are all learning here, and that is the intent. So we'll give everybody, in the interest of time, and that we do have a whole nother part of this presentation, I'm going to go ahead and say, Caroline, why don't you move on to giving the responses?
Okay, wonderful. So for this family, Natalie would be eligible for marketplace coverage, but not BadgerCare Plus due to the 5-year wait period. As we said in the question, she's been here for 3 years under her permanent residency status. So once again, we would have to look at this question in the marketplace application, which would allow for them to bypass Medicaid, specifically for Natalie, and then get her enrolled with financial assistance and tax credits in the marketplace. So Roberto, since he's a permanent resident under the age of 19, a child, he does not have the 5-year wait period. So he would be able to apply for both BadgerCare Plus or Marketplace, depending on the family's income. And then Oscar, because he's a U.S. citizen, would be eligible for BadgerCare Plus or Marketplace, depending on household income, without any consideration of the 5-year wait period.
Okay, great. So Caroline, in the interest of time, I think we're going to go ahead to the public charge section of the presentation and welcome Megan Sprecher, our next presenter. So Megan, go ahead and take it away. There are more questions and I'm going to curate them, and as we have time at the end of the session, if we have time, we will get to the additional questions about immigrant eligibility for Medicaid and Marketplace. But welcome, Megan, and take it away.
Thank you, Shannon. Thanks, Caroline. So I'm going to talk to you about public charge, which you've probably heard about a lot in the news over the last couple of years. So Caroline, if you want to move forward on this slide. So one thing that we wanted to talk about is, our work as the Wisconsin Collaboration on Immigrants and Public Benefits. Our guiding principles are that we understand and respect the fear, confusion, and stress immigrants are experiencing in this challenging climate. We recognize that circumstances change, sometimes quickly, and our aim is to empower people to make informed decisions about public benefits. So giving them the information that they need to decide what's best for themselves and their families. So our 5 key messages today, which we'll repeat at the end, are that most immigrants and mixed status families can safely use public benefits. So most immigrants who are actually eligible for public benefits are not impacted by public charge. I can't say that all immigrants who are eligible are not impacted, but keep in mind that most immigrants and mixed status families can safely use public benefits. Like Caroline mentioned before, public benefits used by the applicant's family members will not count against the person. So where this comes up the most is, will my U.S. citizen child's public benefits impact my immigration case? And it's only public benefits used by the person applying for the immigration status that counts. Number 3, only use of specific public benefit programs can have a negative impact on a person's status, and we'll get into what those specific benefit programs are. Use of public benefits does not automatically make a person a public charge. So it is a totality of the circumstances test. So immigration has to look at multiple factors before deciding whether someone is likely to become a public charge. And then, certainly relevant these days, the 5th key message is that testing, treatment, and preventive care for COVID-19 is not counted against the person. So what is public charge? Public charge is something the federal government, since immigration is federal law, the federal government, when deciding to grant someone entry to the United States, a visa, including a green card, or a change in status, decides, is this person likely to become a public charge, which means, is this person likely to receive certain public benefits from the government in the future? And the big impact of public charge is on people who are getting their green cards through family-based petitions. So that's really what we're talking about today. And the government does a public charge test when someone is applying for a visa, including a green card, or applying to change or renew their status. So the impact is if the federal government decides that someone is likely to become a public charge, that impacts the person's eligibility to get a visa to enter the United States. And that can include permanent residency. So it can stop someone from entering the United States, it can stop someone from getting their green card, and it can stop someone from being able to change or renew their status. The public charge test does not apply to green card holders who are applying for US citizenship. So it doesn't apply at that stage when someone already has their green card and they're applying to become a US citizen. So changes to the Department of Homeland Security public charge rule went into effect on February 24th, 2020. And what we're talking about today are cases where people are applying for their status from within the United States, so applying for their green card from within the United States. So there are a lot of classifications of immigrants who can safely use public benefits. So people on this list, which is largely humanitarian relief, anyone on this list can safely use public benefits and it will not impact their status. So someone who is a US citizen or someone who is applying to become a US citizen is not subject to the public charge test. People who have their green card already, unless they're traveling outside the US for 180 days or more or have certain criminal convictions. People who are refugees or asylees are not subject to public charge. People who have something called special immigrant juvenile status, which is a type of a status for a youth who's been adjudicated abused, neglected, or abandoned. People with a U or a T visa, which are visas for people who have been a victim of a serious crime, including domestic abuse, sexual assault, even human trafficking, and several other types of crimes. People who have a Violence Against Women Act self-petition are not subject to public charge. And then people who have status under the relief under the Cuban Adjustment Act, or the Nicaraguan and Central American Relief Act, or NACARA, or the Haitian Refugee Immigration Fairness Act are not subject to public charge. People who have special immigrant visas through serving primarily as interpreters during the wars in Afghanistan and Iraq are not subject to public charge. And then people who are members and families of the U.S. Armed Forces, Ready Reserves, or military serving in active duty are able to use public benefits, and it's not counted against them for a public charge assessment. So Caroline already talked a little bit about mixed status families, but I did want to reiterate that immigration only looks at the benefit that the individual uses, so the person applying for their status, not what their children or other family members use. So I mentioned before that only certain benefits are considered when immigration is determining whether a person is likely to be public charge or not. So the person that's actually applying for status, what immigration will look at in terms of public benefits usage is Medicaid. So that is looked at for people who are over the age of 21. And immigration does not look at emergency services or prenatal when they're assessing someone's Medicaid usage. So immigration will consider Medicaid for people who are over the age of 21, but will not look at emergency services or BadgerCare prenatal. Immigration can look at housing assistance from public housing or Section 8 when determining if a person is likely to become a public charge. They can look at food assistance from Food Share and cash assistance from W-2 or Supplemental Security Income or SSI. Immigration also can look at assisted living, nursing home, or home care paid by a Medicaid long-term care program. So these are the benefits that immigration can consider when determining if someone is likely to become a public charge or not. And the use of benefit programs that are not on that list will not be considered. So there are a lot of types of benefits that are not considered. They are on that safe list. So examples include emergency services, BadgerCare prenatal, marketplace financial help, the Ryan White HIV assistance, school-based nutrition services, WIC, childcare assistance, Head Start, financial assistance for education. And we actually have a whole fact sheet dedicated to programs that are not on that list. So there are quite a few programs that people can use, even if they are subject to the public charge test. So like I said in the key messages, use of public benefits does not automatically make a person a public charge. So what immigration does when they're determining if someone is likely to become a public charge is they look at a variety of factors. So they look at the person's work history, their skills, their education. They look at the person's income, their assets, and their resources. And under that category, they look at public benefits usage. So public benefits usage is not even its own category. It's under that income, assets, and resources section. Immigration will look at age. So they'll look at, whether the person is in prime working age. They'll look at the person's health, the person's family size, and they'll look at an affidavit of support. So that's where the person that is petitioning for the immigrant to get their status signs a document saying that they'll support the person if it ever becomes necessary. You can go ahead and go to the next slide, Caroline. So I did want to talk a little bit about the pandemic. Once the pandemic hit, we got a lot of questions about COVID-19 and public charge. So as I said previously, immigration clarified that testing, treatment, and preventive care, including a vaccine if one becomes available, for COVID-19 will not be counted against the person, even if that testing, treatment, or preventive care is provided to the person through Medicaid. We want to remind you that the exemptions from Medicaid usage for people who are under 21, for people who are receiving emergency services, and Medicaid usage by pregnant people up to 60 days postpartum are still in effect. So people who are getting Medicaid under one of those categories, it is not considered. Unemployment insurance is not a public benefit, so it is not going to negatively impact someone for public charge purposes. And then benefits like pandemic EBT or PEBT benefits and curbside school meals are not considered a public benefit. So when to refer to legal assistance? This is a really complex topic, and one of the resources that we have is a list of free and low-cost immigration legal service providers in Wisconsin. So as we've said, a lot of people who are actually eligible for benefits are not directly impacted by this new rule. A lot of it has been what we call the chilling effect, where people hear about the rule, they don't know exactly what it means, it's really complex. And so they fear that they're impacted by it and may not actually be impacted by it. But if someone is unsure, an attorney can help them understand how the public charge might apply to their family, how it might not, and how benefits usage could or could not impact the family. So we do have a list of free and low-cost legal providers that specialize in immigration on the website listed. And that's something that people are definitely encouraged to take advantage of. And we have a list in English and then one in Spanish and another in Hmong.
Oh, so I was gonna, Caroline, can you go back? We've got some polling questions for the group. And I'm gonna ask Mike to deploy those questions now. And as you all might guess, they are related to our 5 key messages. So Mike, go ahead and deploy the questions. Here's the first one. Give everyone a beat to respond.
We'll give just about 30 seconds for each one, and then I'll open up the next one, just so that way it's not confusing.
Perfect. Okay, so that completes the polling questions. Thank you all for your participation. Megan, you want to go ahead and review?
Sure. So a review of our 5 key messages again. Number 1, most immigrants and mixed status families can safely use public benefits. Number 2, public benefits used by family members will not count against the person applying for the immigration status. Number 3, only use of specific public benefit programs can have a negative impact on a person's status. Number 4, use of public benefits does not automatically make a person a public charge. And number 5, testing, treatment, or preventive care for COVID-19 is not counted against the applicant.
Great, thanks, Megan. And before we move on, would you mind just highlighting the point about permanent residents, also known as green card holders, and the impact of and the correlation with public charge for them?
So once someone already has their green card, they're not subject to public charge when they're applying for their U.S. citizenship. They just have to be careful if they're leaving the United States and trying to re-enter after more than 180 days, or if they have certain criminal convictions and they're trying to re-enter.
Thanks for that clarification. Go ahead.
So we'll talk about a couple different family stories here, and feel free to type your thoughts into the chat. So Anna has a U visa. Her U.S. citizen child, Manuel, is eligible for BadgerCare Plus. Can Manuel enroll in BadgerCare Plus without compromising Anna's ability to get a green card? So what are your thoughts on that? So I see a couple answers yes, lots of answers yes. Does anyone have any thoughts on why? So what we see is that for a couple different reasons, it's okay for Manuel to enroll in BadgerCare Plus. So yeah, I'm seeing someone type in the chat box that it's because one of the things is because she has a U visa. So that's correct. So that's one of those types of statuses where Anna is not actually subject to public charge because it's a type of humanitarian relief. So Anna is not subject to public charge when she applies for her green card. And then I see another answer saying that the child is not the applicant. Correct. So only Anna's use of public benefits would affect her. But in this case, since she has a U visa and she's not subject to public charge, it doesn't matter even if she gets the benefit. So correct. Manuel's enrolling in BadgerCare will not impact Anna. So the next question that we have is Fatima is pregnant and eligible for WIC. She is undocumented. If she enrolls in WIC, will this hurt her chances of getting a green card in the future? So I'm seeing a lot of answers no. No. Does anyone have a thought on why it's okay for her to enroll in WIC? Right. So, yep, I'm seeing a couple of answers that WIC is not on that list of public benefits that is considered. So, since WIC is not on the benefits that are considered, Fatima can get WIC, and immigration will not consider that in determining whether she's likely to become a public charge. Okay, so we'll talk a little bit about resources. I don't know, Shannon, were you going to talk about this, or do you want me to talk about this?
Either way is fine. I can do the resources if you'd like. That's fine. And then after we review the resources, we'll get to questions. So if any of you are sitting on burning questions, you can take a little time to type them in. So the first resource we have is on health care options for undocumented immigrants. And you can find this resource at the website poster coveringwisconsin.org under the assister enrollment materials. And so this can just be helpful when you're helping people who it seems like maybe they don't have a lot of options. It lays out the options that are there for them in terms of health and in terms of getting health care. We can go to the second resource, which is also found on Covering Wisconsin's website under immigration. And these are the resources that were developed by the collaboration. So if you're looking for a legal referral resource, if you're looking, we have a screening guide. So if you have somebody who presents with questions about public charge and you're trying to help them understand whether or not that is something they need to be concerned about, you can use that screening guide and it'll help you walk through those folks who are categorically exempt, you know, those humanitarian visa holders, citizens of the United States, you know, who may think of themselves as immigrants but are now U.S. citizens, all those unimpacted categories, the green card holders. And then there's also a resource specific to all the various public programs and policies that people may avail themselves to that have no interaction whatsoever with the public charge policy. You can go to the next resource. The final resource is from the Protecting Immigrant Families campaign. They have a variety of resources in a lot of different languages. So this can be a good resource if you're serving populations in some hard to find languages in terms of finding resources on immigration and public benefits. This is a national group, so it is not, you know, Wisconsin designed, but they have some great resources and they also have continual updates on ongoing cases that are before various federal courts. So I think that's the final one. Great. Yes, I was correct. So wonderful. Thank you, Caroline. Thank you, Megan. We really appreciate it. We're going to pivot now to questions. So if you have your questions, put them in the chat box. I have a few I'm going to go back to, and they may require responses from both Caroline and Megan. So here is our first one. Scenario, when someone on a student visa has health insurance through their university, could they qualify for Medicaid emergency assistance due to a hospitalization or surgery?
So this goes back to the question of whether or not they are a childless adult. So even if they're a student, if they're over the age of, you know, if they had their 19th birthday, they're over the age of 18, then they would be in the childless adult category and they would not qualify for emergency services. But that's when we would link them up with a community health center or the safety net programs, specialty care that's available to them, especially in midst of said emergency.
Excellent. Thanks, Caroline. Our next question is, how do we determine if an immigrant is being sponsored, which impacts household income counting for the marketplace? Caroline, were you able to hear that question? How do we determine if an immigrant is being sponsored? Maybe Megan can talk about that piece, and then the impact that that has on household income counting for the marketplace.
So I think just asking the person how they got their status, and if they were someone like a family member petitioned for them, then most likely that family member did have to submit an affidavit of support on their behalf.
Yeah, but then when it pertains to a marketplace application, the individual would be applying as their household. So it would be their tax filing household. So however they're going to apply for taxes would be how they would apply for marketplace.
Thank you both. Our next question is, would COVID-related testing and care be considered an emergency benefit? Could an undocumented immigrant get emergency Medicaid for COVID treatment?
So emergency services would be separate, but there are COVID specific programs that would be available to anyone, regardless of status. And that is that's specifically related to COVID.
Great. Those are all the questions I have recorded. If I have missed your question, if you want to pop it into the chat again, please do so. There have been lots, and I've been trying to keep track, but it is a bit of a we are at 10:15, which is our ending time, but we can stay on for perhaps another 4 to 5 minutes to answer additional questions. Okay, so we have another one that came in, and it is, once an immigrant gets his or her green card, can they have access to the marketplace right away? Do they have access to premium tax credits right away?
Yes and yes. So once they have their green card, that triggers a opportunity for a special enrollment period. So they don't even have to wait till open enrollment. They could use the date either on the card or on the letter when they finally receive the card for their permanent residency status. And then once they apply for Marketplace and are approved and everything, it would start the following month. And that would be with whatever tax credits they are eligible for as well.
Great, thank you. And Caroline, can we go back to the point about a sponsored immigrant and their application to the marketplace and how household income is considered? Can we just clarify that one more time?
Sure. So if someone is applying for Marketplace, they look at the modified adjusted gross income tax rules, which means it's how they file their taxes and the household, their tax household. So depending on that individual, if they are being claimed as a dependent, then they would be looking at that household's income. So whoever their the person filing taxes on their behalf, they would look at that household. If they themselves are filing taxes on their own, they would apply for Marketplace that way. As an enrollment assister, it's not, it's however they are presenting themselves. It's not our role to interrogate them on how they are filing their taxes. All we can do is guide them and let them know what they are eligible for based on the information that they provide.
Thanks, Caroline. Next up, we have for immigrants with green card, do they have to stay in the country for the whole year to keep a plan under Marketplace?
That's a great question. So if they're in the country, I don't know off the top of my head. I know that there are some rules about special enrollments when entering back into the country. I know that there is some time frame, and for some reason 2 months within the country is I'm reminded of that. But,
that's okay. It's
yeah.
a question we can follow up on. It's a great question. We'll do some research, and maybe after the conference, or just at a later date, we'll post some responses.
Yeah, you guys are you're showing where I'm fuzzy.
Okay. We have a question. What is Medicaid spend down, and when does it apply? And this one doesn't seem particularly related to immigration-related policies. So maybe we'll just pause on that one. We'll add it to the general list of questions. All right, we'll go on here with one last question. Can Caroline be more specific about the COVID programs available for folks, for non-immigration status people that don't qualify for the BadgerCare Plus emergency program? I am not aware of any.
Yeah, so and a lot of times, so yes, there are availability of free testing and follow-up care for testing depending on on the provider. So whether it's the health system or clinic, and in some cases, insurance companies are waiving testing fees and certain costs related to COVID. But it is a case by case. It's not a overarching program. And then, of course, with community health centers, we have our sliding fee scale that we are able to assess people, and some of those fees are also being waived specific to COVID.
Okay, well, thank you all. Thank you, audience, for your active participation, your great questions. Thank you, speakers, for sharing your knowledge and expertise. We really appreciate it. And I will hand it back over to Allison at Covering Wisconsin.
Yeah, thank you so much, Shannon and Caroline and Megan. That was awesome. Obviously, lots of really, really good questions. Thank you for audience for sticking with us. I hope we got to most, if not all, of your questions, and we'll try to get those that we weren't able to respond to out either in an email following up, or we'll post them on the web conference website. So right now you have a break. Our next session starts at 10:45. And so please get up, stretch your legs, get some food, get some water, get some coffee, and we will see you back in a bit. You can keep this link open because we'll be right back here. So thank you.